Welcome, and I hope this finds you in good health. My name is Gilbert Gaston Charles, a clinical nutritionist and dietitian. And as of today, we'll be talking about medical nutrition therapy in Mpox. Well, let's start with the overview. The monkeypox, abbreviated as Mpox virus, is a member of genus Orthopox, family Poxviridae. Other members include cowpox, Vaccinia, and variola, the smallpox viruses. The infection was first seen in 1958, and rodents are believed to be a major reservoir in Africa. It can be transmitted directly through animal to human transmission or through human to human transmission. According to CDC, currently there is no treatment approved specifically for Mpox, so we mostly deal with the symptoms and the signs that are being shown by the Mpox infection itself. As we continue, for most patients with Mpox who have intact immune systems and do not have a skin disease, supportive care and pain control will help them recover without medical treatment. Some patients have experienced severe manifestations of Mpox, such as ocular infections, neurologic complications, myopericarditis, mucosal lesions, and these lesions mostly occur on the oral, rectal, genital, and urethral areas, and complications from uncontrolled viral spread due to moderate or severe immunocompromise, especially here I'm talking about the HIV patients. So, who is at risk now? You should know who is at risk. First, people who have contact with someone who has Mpox. So, if you have ever had contact with a person suffering from Mpox, just know that you're already at risk of developing this Mpox virus because it's transmitted through contact from one person to another, the body fluids and so forth. But also, the number two are people who have contact with clothing, bedding, towels, objects, electronics, and other surfaces that have been touched by someone with Mpox. So it is very important to take precautions as you touch different stuffs. Make sure that you wash your hands regularly and maintain all the infection preventive control measures. But also, the health workers are at great risk. Why health workers? Remember, health workers are the ones helping these patients to get better. So, in the process of treating, you may end up being the number two or the number one sick patient right over there. It is important to make measures for infection prevention and control while taking care for Mpox infected person. This is for both family members, the medical personnel, or the health workers dealing in direct contact with this uh, Mpox patient. Well, here is the best part. We're not going to have a very long presentation. It will be short and clear just to make up a nutshell of what is really needed as you consider nutrition in Mpox disease. First, let's talk about protein requirements for these patients with Mpox. Protein requirements for patients with Mpox infection are relatively increased related to the normal requirements. The normal requirement is zero point 0.8 grams per kg of protein, grams per kg per day. That's the normal requirement of protein per day. But the protein subscription may range between 1.2 to 2 grams per kg per day, depending on tissue damage, ration, and individual requirement, but sometimes it can be even higher than 2 grams per kg per day of a person. This is regarding to the condition of the patient at that time. But also considering fever, skin lesions, and other complications, they keep us to this criteria of this range of 1.2 to 2 grams per kg per day. Good sources of protein include meat, fish, eggs, dairy products, and plant-based options like beans and nuts. All these will help you to have your servings of protein. Well, consider and also remember that you need to make individualized management for each patient. Well, let's carry on with the fats now. Recommendations are balance, first of all. Aim to get about 20 to 35% of your daily calories from fats, focusing on unsaturated fats. The sources include healthy fats from plant based oils, nuts, seeds, and fatty fish in the diet. Avoid or minimize intake of saturated and trans fats to maintain overall health. At this moment is whereby you need to reduce any inflammation in the body and associated oxidative stress. Remember, the patient is already having oxidative stress that is from the infection itself. Well, what about the carbohydrates now? What do the recommendations say? Carbohydrates should make up about 45 to 65% of total daily calories. For someone consuming 2,000 calories a day, this translates to about 225 to 325 grams of carbohydrates according to that range. So it matters with the individual requirements of your patient. Focus on complex carbohydrates. Choose whole grains, fruits, vegetables, and legumes. These foods are rich in fibers, vitamins, and minerals, which are beneficial for overall health. Limit simple carbohydrates. Minimize intake of foods with added sugars and refined grains as they provide little nutritional value and can lead to increased inflammation. Sorry for the type errors in my text. And what more now? Vitamin C. Vitamin C is very important right here. Vitamin C is essential part of skin health. Serves as a small molecular weight antioxidant. When you talk about antioxidants, these they help to boost your immunity and as a critical factor for collagen synthesis. This is vitamin C. It decreases photo damage and is needed for adequate wound healing. Remember, it is already important for collagen synthesis. As a result of lesions due to Mpox, vitamin C should be considered in the diet and supplements prescribed to Mpox patients by the clinical nutritionist and dietitian and nutritionists in the clinical settings. The RDA, remember, for vitamin C is 90 milligrams for adult male and 75 milligrams for adult female. But you may go a bit higher according to the requirements of your patient and the clinical presentations of your patient. What more now? Foods rich in vitamin C. We have the bell peppers, broccoli, papaya, guava, citrus fruits, tomatoes, potatoes, spinach, mangoes, and red cabbage also, etc., etc. But these are readily available in the market, especially on the African setting, and maybe your good sources of vitamin C. These foods can be part of the diet plan for your Mpox patient. However, consider actual food servings needed by the patient according to individualized requirements. Vitamin A. Vitamin A is important for normal vision, immune system, reproductive health, and essential for mucosal homeostasis. As Mpox infection may lead to ocular infection, skin lesions, and increased risk of bacterial infections, vitamin A should be considered in the diet and supplement prescription to Mpox patients. RDA for men and women is 900 and 700 micrograms retinal activity equivalents per day. What more again? Foods rich in vitamin A. This is very important part. You should know the foods, not just the nutrients, but also the foods that provide the actual nutrients that I'm talking about right now. Eggs, carrots, liver, sweet potatoes, spinach, mangoes, milk, broccoli, cheese, fish, kale, fortified breakfast cereals, and leafy greens, vegetables. All these provide you with vitamin A, etc., etc. What more? Other vitamins to be considered as part of nutrition therapy for Mpox in reference, sorry for the typing error, in reference to complications associated with Mpox infection. First is vitamin K. You actually get plenty of this from the green vegetables, and I've mentioned a lot of them just before the spinach, broccoli, and so forth. Vitamin D. You can get it from milk, sardines, fish, cauliflower. Vitamin E from tomatoes, sunflower oil, almonds, pumpkins, and red bell peppers. Vitamin B5, this is pantothenic acid, and also vitamin B3, niacinamide, and vitamin B2, riboflavin, plenty in milk. What more again? This is the mineral part. You should consider zinc. Zinc plays a crucial role in supporting the immune system, which is particularly important for patients with Mpox, formerly known as the monkeypox. It reduces viral replication, that's zinc role, and promote immune functioning, as well as important in skin health. Remember that adverse complications were seen in patients with, especially who were immunocompromised. So, adding up zinc in your diet will eventually help to boost up the immunity of your patient. It doesn't matter the patient is immunocompromised or is having an intact immune system. Still, we need to push up the immune system. We need to reduce the replication rate of the Mpox virus. This is something that has just risen again worldwide right now. Dietary sources include zinc-rich foods in the diet, such as meat, shellfish, legumes, seeds. Here I'm talking about like the pumpkin seeds, yeah, nuts, dairy products, and whole grains. Again, we're moving around the same foods. But remember, you need to have the actual servings that your patient requires, and they should meet the RDAs or above. In some cases, zinc supplements may be recommended too. What more considerations do you think of? So this is Mpox virus having attacking a lot of people right now, but and the World Health Organization is really keeping an eye on it. And as public health specialists, we really need to have a look at Mpox virus in a third eye position. So welcome for more comments in the comment section area. That what more considerations do you think of on nutrition management or other managements that we should really consider? The fluids, I've not talked about it, but you can also add up about the fluid recommendations that we can consider as we are treating patients with uh, Mpox virus. Well, I would like to say thank you very much for your time. I've gone like 12 minutes and now getting to 13 minutes, and this I hope this will be very potential to you and also it's potential to me. Let's fight against Mpox virus right now. Let's save the world. Thank you very much. Diet is therapy.